Quality measurement is becoming more known with grades of hospitals, nursing homes, and doctor groups becoming more prevalent through a lot of organizations. But what about prescription drugs? Welcome to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Dr. Samantha Collier. She's the Chief Medical Officer of HealthGrades, one of the nation's largest independent healthcare ratings companies. HealthGrades provides ratings and profiles of hospitals, nursing homes, physicians, and even prescription drugs in an effort to help millions of consumers with their healthcare choices. HealthGrades provides comparative quality outcomes on almost 5,000 hospitals and receives about 50 million annual page views. Dr. Collier has been HealthGrades Vice President for Medical Affairs since 2002. In addition, she works as a hospitalist at Kindred Hospital in Denver, providing weekend coverage for the critical care team requiring intensive care management of 15 to 20 patients in a long-term acute care setting. Today, she joins us from HealthGrades offices in Denver, Colorado. Dr. Collier, welcome to ReachMD.
Thank you.
Well, this is very timely because in my role at the Tribune, I write a lot about prescription drugs, and it seems that every year almost we have an issue, whether we have Vioxx or Avandia and so forth. And so it's very fascinating that HealthGrades, which I'm sure a lot of our provider listeners and consumer listeners out there know, does ratings of hospitals and nursing homes and the like. But you're getting into the prescription drug area, which seems to be fascinating. If you could tell us about how that started and what people need to know.
One of our missions is to guide America to better health care. And so with that, if you think about all the other things that we do, I think it's just a natural extension of our mission to go into drug ratings. So ratings on hospitals, nursing homes, physicians, having medical cost reports on how much procedures cost. All of this is to help the patient navigate the healthcare system in a way that is actionable, where they can make good decisions for them and their family. So the drug ratings was really a response to a natural extension of our mission, but also as we would get frequent questions from patients, customers, even physicians, nurses, and so forth about, where else can I find information about medications, drugs, if we want to call them prescription drugs. And so, again, using publicly available data, we thought it would be a real value add to be able to have a forum for patients to come to, not only to get information about that drug, but to be able to rate its effectiveness for this particular patient and see how that stacks up to what other patients thought.
And just how many drugs will be rated on this system? And also, how does that work? Because it just seems to me that physicians would also find this interesting because, physicians have so many choices to choose from, as do consumers in certain classes. And so this would seem to have some real value to a lot of people.
Well, I think that's an excellent point that you make about it being a resource for physicians. I think that initially that was not HealthGrades' prime objective. It was really, again, our main customer is the patient or the consumer, but certainly I think physicians having access to a database of, for example, one of the things that patients would rate would be, how tolerable were the side effects. And interestingly, most physicians in general tend to downplay side effects. There was a recent study in the August issue of Drug Safety that looked at a particular drug, what we call statins, that treat cholesterol, high cholesterol. And, almost universally, the physicians downplayed the side effects that were well known to this particular group of drugs. We tended to attribute it to age, if someone was older, or that, maybe they were just a little bit depressed, or, the side effects are worth living with because it really does good for your cholesterol. But the bottom line is that physicians tend to really underestimate the side effects and the impact on quality of life. So having something that the patient can print out, which they can on our site, and show the physician, here's how I rated it, and here's how others rated it, I think, if anything, at minimum, will start an excellent dialogue between that patient and physician. The physician may be, wow, you are having significant side effects. Maybe we should consider a different drug. So it's not really an end-all, be-all of what drug you should be on, so much as it gives you some empowerment and knowledge to have a really good, informed discussion with the physician.
And the number of drugs we're talking about we're talking like more than 4,000 prescription drugs.
Yeah, it's practically every medication you could think of would be on there.
And what is displayed when someone calls up the name of a drug if they were to go on the website and check this out?
Well, there's a couple ways they can search for it, but they can either search by condition. So, for example, if you have a particular diagnosis or condition and you want to know what some of the drugs are that treat that because you don't know, you could search by condition first on the drug ratings tool, and it'll list all of the drugs that could possibly be used for that particular condition. Alternatively, you can search by the specific drug you're looking for, either one that you're taking or one that you're interested in, and it'll tell you what conditions it also treats and provide you with some alternative drugs. You'll also be able to fill out a really brief survey about what you think about the drug that you're taking with regards to tolerability, cost effectiveness, those types of questions. And once it's done, it'll display, it'll let you know if other patients have filled out a similar survey for that particular drug. You will be able to see what other patients thought about it on average as well and how many patients filled that out. And then at the very end, you can print out a report that shows how you scored that particular treatment, and you can print that out and take that into your physician.
Well, if you're just joining us, or even if you're new to our channel, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and joining me today is Dr. Samantha Collier. She's the Chief Medical Officer of HealthGrades. You may have heard of HealthGrades. It is a company based in Denver that is on the internet, and they have been rating hospitals and nursing homes and physician groups for years now, but they recently started rating prescription drugs, and we're talking about that today. And if I could, Dr. Collier, ask you, where does the information come from? Because I know that if a consumer, when there's a certain issue that comes up, whether it was the Vioxx withdrawal of a few years ago or just in the last year you had the diabetes drug situation with Avandia, nobody knows really where to go. They might pop in in the drug name into Google, and who knows what'll come up. You might get a order form for some Canadian pharmacy that you don't even want any part of. And so basically, you guys would be providing a clearinghouse for these people. And do you get your information from clinical trials or JAMA articles, or where do you get your information so people can know that it would be credible?
The information that we get is from an organization called IMS, and also IMS. From First Data Bank Corporation. And so IMS has their own content information. So in other words, if I were to look up, what is a statin, there would be a brief explanation of that on the drug ratings tool that comes through them. And I actually forget the source they use, but when HealthGrades acquired this data, that was one of my principal roles, was to look at this, to check for accuracy, that the source was good and those types of things. So yes, it's definitely a reliable source.
And also for the consumer out there and even the physician listening, I know that there's a lot of movement afoot where the copays are rising. People are moving from copays to coinsurance. So let's face it, the cost of prescription drugs are generally not rising. So if I'm on a specific treatment and I wanted to look into a generic, or even if there was information about a drug that was going generic, would I be able to find this type of information on HealthGrades' site?
Yes, you would. The plan is to make sure that this stays updated so that you'll know if there are generic alternatives. And so if those come out subsequent to the last update, you would automatically see that there are generic alternatives to that, or if there is not a generic alternative to that.
And it's interesting because I think of my 74-year-old mother and her friends, and they compare notes about the statins that they're on and so forth. I see here in some of the information that HealthGrades provided that you can go on there and actually see how often a drug is used. And so some people get caught up in why is so-and-so on this or why isn't that? But that is valuable information for consumers, isn't it?
Sure. Sure. I think that there may be different reasons regarding what type of information people are trying to get out of the drug ratings tool. But in essence, having some subjective information about what other patients thought in general tends to be pretty powerful. I think, again, patients already have some idea of whether this drug is working for them or not. No different than when I'm doing research on a car. I generally have it narrowed down that I may want this car versus that car. And I may be looking specifically for some subjective information from other consumers to find out what did they think about this car versus that car. At the same time, I also want some expert opinion on that as well. And so I think HealthGrades combines both.
Have you found that in your market research and so forth, is there a certain type of patient that is going to this website compared to your others? Or also, why did you start this? Did you get a lot of demand from patients saying, boy, oh boy, it'd be great if you had drugs on your website?
There was a lot of demand. We would get, random customer service calls, inquiries about information about medications. And I think, again, that just underscores a couple of things. One, that consumerism is taking off, that there is also heightened visibility that not all drugs are the same, even in the same class. But more importantly is that costs associated with medications, or specifically prescription medications, are skyrocketing. And so I think as patients take more and more of that burden, it necessitates having more and more information to make decisions on. So a combination of all of that is really why we released this drug ratings tool. And we've just recently released it, not quite a month ago. And so, I think we'll have to study the demographics. But I don't know that it'll be so dissimilar from our current demographics, which is typically the woman, the head of the household, so to speak, who's trying to take care of her family, their particular health care needs. But I would imagine that the drug ratings tool might be slightly different in that we'll probably see maybe even a slightly older population looking this type of information up, or at least their children doing that. Again, because we tend to see in the older population, they're the ones that are not only taking more drugs, but experiencing more side effects.
Well, we would like to thank Dr. Samantha Collier, who has been our guest. She's with HealthGrades, and HealthGrades is based in Denver, Colorado. It's a national healthcare ratings organization. You may be more familiar with their ratings of hospitals and nursing homes and physicians groups, but they are getting in a big way into the ratings of prescription drugs. Their effort covers 4,300 prescription drugs. Patients can go, doctors can go and print a free report detailing their findings to share with their doctor. I'm Bruce Japsen of the Chicago Tribune. I've been your host. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. To listen to our on-demand library, visit us at ReachMD.com, register with promo code RADIO, and receive 6 months free streaming for your home or office. If you have comments or suggestions, call us at 888-MD XM 157. And I'd like to thank you today for listening.
This is Dr. Mitch Cohen with Elma Family Medicine in Elma, Washington, and you are listening to ReachMD XM 157, the channel for medical professionals.